Hi, my name is Brenna Furlong, and my topic is anorexia nervosa. First, I will discuss what is anorexia nervosa. It's a complex and severe psychiatric condition which is marked by serious self-imposed starvation as well as malnutrition, and this can lead to a low body weight as well as other medical complications. People with this condition tend to obsess over their body weight and food as well as have a distorted image of their body. Individuals with anorexia often have an extreme fear of gaining weight, as well as a struggle to seek help or fail to see the seriousness of their behaviors. There are two subtypes of anorexia nervosa: restricting subtype and binge eating purging subtype. It is also common for individuals with anorexia to have comorbid disorders such as depression, anxiety, substance abuse, trauma related disorders, and other things as well. The definitions of these subtypes: first, binge eating purging subtype is described as eating too much or more food than is normal for the individual, and they then force themselves to purge their food. And this can be through means of vomiting, taking large amount of laxatives, or any other kind of method to clear bowels. Restricting subtype is described as an individual severely limiting their food intake as well as tracking their calories. Foods that individuals tend to limit the most are foods with high carbohydrates and fatty foods. Some restrictive behaviors that patients might report are things such as calorie counting, portion control, and they also might work out for excessively long periods of time. The DSM 5 diagnostic criteria, um, A is restriction of energy intake relative to requirements, leading to a significantly low body weight in the context of age, sex, developmental trajectory, and physical health. Significantly low weight is defined as a weight that is less than minimally normal, or for children and adolescents, less than that minimally expected. B is an intense fear of gaining weight or becoming fat, or persistent behavior that interferes with weight gain even though they are already at a significantly low weight. C is a disturbance in the way in which one's body or weight or shape is experienced, and this is undue influence of body weight or shape on a self-evaluation, or a persistent lack of recognition of the seriousness of their current low body weight. Some symptoms that go along with anorexia nervosa that doctors might look for when assessing a patient is amenorrhea, which is the absence of a menstrual cycle, cold intolerance, constipation, fatigue, extremity edema, which is excess fluid in extremities that cause swelling and irritability. The prevalence and onset of anorexia nervosa typically begins in adolescence or young adulthood, and it is more prevalent among women. About 92% of affected individuals are female, and it is less prevalent among non Hispanic Black and Hispanic populations when compared to white populations. The incidence of anorexia is increasing globally and has continued to increase every 10 years since 1930, and it is most prevalent in Asia and the Middle East. The etiology and risk factors of anorexia. So, experts have found that the cause of anorexia is unknown. However, they believe that it typically starts with regular dieting, and that worsens over time. Although there's not a known cause, they believe that there are many risk factors that might contribute to anorexia nervosa, some of them being low self-esteem, perfectionism, being a high achiever, family dysfunction, family weight and food issues, and more. There are also some sports that might play a role, as they emphasize shape and size, and there is a pressure to remain thin. These sports include things such as ballet, bodybuilding, cheerleading, etc. Different forms of media also play a role in anorexia nervosa, as professions such as modeling and social media. Influencers tend to promote unrealistic standards of thinness, which are further perpetuated by makeup and things like photo editing. The media also, in recent years, has had an excessive focus on diet culture and weight loss, which means that the media suggests being thin is associated with standards of beauty, good self-esteem, and self-control. The effects of anorexia nervosa, there are many different medical complications that are associated due to long-term weight loss, malnutrition, and purging behaviors. It also can affect organ systems such as the cardiovascular system, gastrointestinal, renal, and hematologic systems. Common complications associated with anorexia are bradycardia, hypotension, electrolyte abnormalities, renal impairment, and osteoporosis. In severe cases, it also can lead to end-stage renal disease, salivary gland hypertrophy, delayed gastric emptying, as well as esophageal rupture. Some treatment options for anorexia nervosa, they tend to focus on nutritional rehabilitation as well as psychotherapy, but there are a couple different options that people can choose from. One is family-based treatment. This treatment involves 3 phases over 6 to 12 months, and it is seen as very effective compared to others as it has a 30 to 60% remission rate. The first phase focuses on engaging the patient's guardians in the treatment by having them promote healthy eating habits as well as weight restoration, and parents have to pay close attention to their behaviors, such as exercise and eating, restricting foods, if they're purging, things like that. The second phase, they slowly start to shift responsibilities of eating back onto the individual. And then in the third phase, they focus on family communication as well as promoting independence. In cognitive behavioral therapy is another treatment option, which focuses on a patient's eating habits and exercise habits, as well as their negative thoughts regarding weight, eating, and body. It helps some patients, but some other patients do not see significant changes in their behaviors. Inpatient hospitalization is typically recommended to a patient who has significant hypotension, dehydration, severe electrolyte abnormalities, arrhythmias, and severe bradycardia, as well as suicide risk and a BMI of 15 or less. In these, they stay in the hospital and they use methods like refeeding, and they start with 1,200 calories per day. In outpatient programs, these are for those with anorexia who did not need immediate hospitalization, but the goal of these programs are to prevent relapse, as well as having this condition become long lasting. It often involves going to therapy 2 to 3 days per week and may involve partial hospitalization where they will be there for 6 hours a day. And then the last one is pharmacotherapy. However, this involves giving medicines to the patients. It can be SSRIs typically, but this is not seen as the first line treatment, and it's not used for patients who do not respond to initial treatment, as it seemed to have little effect on patients with anorexia. These medicines typically don't have an effect on weight gain or improvement of symptoms. However, sometimes it is still used, and it's typically with a combination of therapy. Lastly, we have recovery. So, individuals with anorexia nervosa typically do not seek help, which can make recovery difficult. But remission rates of anorexia vary, with approximately three-fourths of patients treated in outpatient setting achieving remission within 5 years, and the same proportion also have good to intermediate outcomes. But relapse is more common in older patients as they have had a longer duration of anorexia. They may have also had a lower body weight at the end of their treatment, and may have other comorbid disorders that we discussed before, such as anxiety or depression. Patients who achieve partial remission unfortunately often develop other forms of eating disorders, and patients who do recover report a variety of reasons for their recovery, some of them being leaving home, therapy, medications, increased self-esteem, as well as many other things. And that's my works cited. Thank you so much for watching, and I hope you learned more about anorexia nervosa.